Great. Let me ask each of you, maybe as we move to close, to put your crystal ball in front of you and to think about predicting the future. We started this conversation this morning talking about value-based purchasing and trying to think about what can be done in sort of what we can do collectively through policy, through incentives, and systems redesign to kind of shape a better and more sustainable healthcare system. So maybe I could ask each of you to identify what you think are going to be the most critical and important things that collectively as a healthcare system we need to focus on in the near future. Francois, maybe I could start with you.
Yeah, okay. Look, and this might seem a little bit antithetical to the conversation, but I really feel that at this point, CMS and CMMI in particular should ratchet back. And I know that sounds bizarre, but it hasn't been easy for them. In other words, when you look at the evolution of the Medicare programs and new payment models, it's jumps and starts. It's difficult. You know, you have stakeholder input. They choose to listen to the stakeholders they choose to listen to, and out pops the program. And I don't think any one of us here would say each one of these has been a stellar A. You know, quite the contrary. And so the signal, I think, effect has been phenomenal. They've been able to change the dialogue in the country. Private sector payers have now moved into the fore. And I think it is time for CMS to say, okay, we're going to continue, but we're not going to pretend or even try to make the models that we've disseminated become in any way, shape, or form the rule of the land, because it's far too early. And so we sent out a signal. We're going to continue to send out this signal. We're going to continue to look at how we can move down the pathway of value-based payment, but we're going to rely on innovation in the private sector as the primary engine over the next 4 to 5 years, so that we can learn, the federal government can go back to our position of learning what is working with these models as they evolve, as the delivery system evolves, as people make different choices and different selections, and then we'll make decisions around which ones of those we should think about bringing in and redeploying. So I think, you know, CMS has played its role very effectively, and it's now time to voluntarily take a step back and say, let this play out in the private sector. Let's look at what other types of innovation can emerge so that the delivery system can accomplish its full transformation, and then we will learn from that and up the ante at that point.
Great.
Art? Well, if you look back over several years, there have been more innovative health delivery system and payment systems out there, and they have kind of come and gone. So why should it be different now? Well, in my opinion, it is different now. With President Obama's ACA, with patients having more skin in the game when it comes to costs, things are truly different this time. Have we come up with a final solution? Is it out there right now? I don't think so. But I think there are many good people, smart people, who are trying to do the right thing. And I think that over the coming years, we're going to get to where we need to be. We need to maintain or even improve quality. I don't care how low you bring down costs. If quality isn't there, it's no good. So you got to maintain quality. You've got to hold down costs. We know what the cost drivers are out there, and they need to be attacked individually. It can be done. And accessibility. We've gone a long way in terms of accessibility with the ACA, but we're still not there yet. So I am very optimistic that with the people that you've got right here in this room, with their colleagues that are out there, a lot of people are working on this problem, and I think over the next few years we'll be in a much better place when it comes to quality, cost, and accessibility, and we need to.
So Ateev, high expectations for you.
I know, last but not
There
least.
you go. Just do that.
I think just to end, I would maybe build upon what Francois was saying about the ACA took the approach as we don't know how to decrease healthcare spending. and we're going to try a lot of different things. We're going to do a lot of experiments, and 1,000 flowers bloom, and see, put a lot of seeds out there and see which flowers bloom. And we've tried and we've discussed so many of those different things, from ACOs to meaningful use criteria, the EHRs, as well as VBP and bundled payment. And where I think we should recognize is go back to where we started, which is we were trying a lot of experiments, and some experiments work and some experiments don't work. And I am fearful that we have codified certain things. So for example, we have a large group of people that are like patient-centered medical homes. They're the right way to go. They make sense theoretically to me. Study after study shows they're not really having much of an impact. We just can't go based on theory anymore, and we have to say, okay, the evidence is that particular intervention didn't work. Maybe ACOs did work. Let's put more of our energy there. And again, to sit back and say, okay, what's working, what's not working, and start eliminating programs. We criticize doctors for continuing to do stuff that's not evidence-based, but in the policy arena, we seem to always continue efforts that don't have any strong empirical base, but just sound good in theory. And I think we need to be thoughtful about what's working, what's not working, and stop doing what's not working.
Great. So this has been a great discussion. We've reviewed and discussed a lot of information today on topics such as the importance of transparency in healthcare, the increasingly high cost of specialty medications, the influence of the Affordable Care Act, and issues such as the sustainable growth rate. There's of course a lot more that we could cover, but unfortunately our time has come to an end. On behalf of our panel and the editors at the American Journal of Managed Care, I thank you for watching, and I invite you to follow the discussion on healthcare reform as we bring you the latest information in a series of related videos featuring our expert panelists on ajmc.com.